Hello everyone, this is Dr. Shawn Pourgol. I'm an osteopath and today I want to speak with you how you can find a job as a manual osteopath in a hospital. Hospital, you say, for manual osteopaths? Yes. We think laterally. I always teach my students to think laterally. Do not think in a straight way and always find ways to expand the osteopathy profession. Instead of just graduating, opening a clinic, I always try to teach my students to think differently and find different ways they can practice. And getting osteopathy inside the hospital setting is a good way to make a good income, get tons of patients, and also expand the osteopathy professions. For example, we opened a clinic inside a private hospital in China. One of my clinics, Osteopathic Chronic Pain Clinics of Canada, that I founded 3 years ago in one clinic in Toronto. Now we have 329 clinics in 30 countries. One of them is inside a hospital, private hospital in China. After we set that up, we got a number of Chinese medical doctors registered at National Academy of Osteopathy and National University of Medical Sciences to study osteopathy. This is how we expand osteopathy. When you go to a unique way, different way, things that people are not exposed to osteopathy, they become known, they understand what is osteopathy and they become interested, and gradually the profession grows. This is how we got osteopathy expanded to 72 countries, by doing things differently and uniquely. We bring in innovative osteopathic education. Working in hospitals has a lot of benefits, but to get inside that is unique because it's not just like a rehab clinic that you can apply for a job as a manual osteopath there. There are two types of hospitals in existence. Ones are private hospitals that are set up by corporations, and others medical doctors as a for-profit organization to make money, to make profit. And then the other one is a public hospital that is governed by the government. Government gives them a specific amount of budget, and they have to work within that budget. Approaching these two different type of hospitals is totally different way you have to do it. First of all, while you can approach to the human resources department and send your resume, apply to them, the better way is to approach the president of hospital and also the chair, the president of the department of physiotherapy, orthopedics, or occupational therapy, things that work with the hands, to approach the chair of that department and introduce to them what is osteopathy and what you can do for them. As I said, for each one you have to approach them differently. You have to see what they want. Private hospitals, obviously, they have to ensure that they make money so they survive and they continue operation. So to them, when you are approaching to private hospitals, then you have to approach them on that aspect. You have to explain to them how osteopathy does wonders in treating chronic pain, how chronic pain is so hard to take care of it and not so many other professions can help, and osteopathy is amazing for that. It is famous for that. Explain to them that and explain how you can bring more patients to them, how you can get their patients better, that would generate more income for them, and set that hospital from other hospitals, that they can offer something to patients for their chronic pain that other hospitals do not have, and that can bring more clients to the hospital. So focus on that aspect of what you can do for them to increase the bottom line, to increase their income. For public hospitals, they generally do not care about making income because they're covered by government insurance. They have a set budget, and whatever money they make the government pays for patients, so you cannot approach them on that way by telling them how much money you will make for them. For them, you have to approach how much money you will save for them. They have a specific set of expenses budget that they cannot pass that, and usually they're always struggling to keep the cost down. Orthopedic surgery is a highly expensive procedure in hospitals. If you approach them in a way that for them to let you try osteopathy on their chronic cases that require surgery, and that some of them can get better, that those patients may not require surgery by using your manual osteopathic care, that will save a lot of money to the hospitals. A lot of medical chronic pain clinics, a lot of surgeons, before they do the surgery, they send the patients to manual osteopathic care, hoping that the patient get better, so to avoid surgery and that invasive procedure. You can explain all that to the chair of the department, to the university president, and step by step explain to them how your services can lower the cost for them. To the physiotherapy department also as well. For example, for this condition, for the lumbar disc conditions, the standard procedures in physiotherapy says that the patient has to go for 6 months of therapy, 5 times per week initially, reducing the frequency. But with manual osteopathic care, you can get the disc patient healed a lot faster. If the patient gets better faster, it means that the patient will not use so much of the services of the physiotherapy department in the hospital, and that would decrease the cost as well for the hospital. So you have to approach them this way. We have we change the osteopathy profession from inside out. This is what I always do. I always want to shock the system, to change the system for better from inside, to find new ways of doing things. We expanded osteopathy now to so many hospitals. In China, we have our alumni there. In Vietnam, in Iran, in South Korea, in Malaysia, so many places. If you're a dual degree manual osteopath, for example, if you're a physiotherapist dash manual osteopath, if you're a medical doctor dash manual osteopath, if you're an occupational therapist dash osteopath, you have a lot easier way to get a job inside the hospital, because they already hire medical doctors or physiotherapists and so on. For example, one of our alumni in Dubai, United Arab Emirates, he was an orthopedic surgeon. He got hired as an orthopedic surgeon in a hospital. Once later on, when he became a manual osteopath, they asked him not to do orthopedic surgery, just to do osteopathy, because orthopedic surgeons they can find easily there, but not so many good manual osteopaths can be found. And that hospital heavily marketed on chronic pain management through osteopathy. So if you are already, for example, in Iran, we have 400 students at National University of Medical Sciences. They took a transitional doctor of physical therapy as well as doctor of osteopathy program, and many of them work in hospitals in Iran. In South Korea, National Academy of Osteopathy has close to 100 alumni there, and many of them are almost most of them are physiotherapists, and a large number of them work in hospitals. In Vietnam also, I have some 2 students there in hospital. One of them is a French osteopath, and he is working there. So that's also a good opinion. If you're planning to work in other countries, you can approach hospitals, also medical clinics, rehab, and so on, physiotherapy clinics, but you can also approach hospitals to see if you can get a job in there too. Finding a job in hospital would be a fun way to explore a country, get a job. They can do all your visa requirements and everything, and having a job in a hospital also will do wonders for your future. You can set up a department of osteopathy there. Most likely you become chair of that department, and that will look good always for you in your advertisings in future. When you go back to your home country, you can always say you were chair of the department of osteopathy in so-and-so hospital. It also elevates the profession a lot by having manual osteopaths inside hospital. We made the profession mainstream. When a profession gets into a hospital, that becomes a mainstream. All the doctors and so on, nurses become exposed to manual osteopathy. A lot of them themselves become patients, and once you know what happens when once somebody gets the osteopathic treatment, they become a lifelong patient of osteopathy, because osteopathy is so pleasurable, so beautiful, and so much fun. They become patients for life. In Canada, manual osteopaths have a 97% patient loyalty rate, the highest of all health professions, even more than family physicians, who have 75% patient loyalty rate, meaning 97% of the patients who see a manual osteopath stick with that manual osteopath for life. I had many clinics even long time ago before I have this clinic, and we had multidisciplinary clinics offering chiropractic, physiotherapy, massage therapists, acupuncture, psychologists, and manual osteopaths. The manual osteopath was always full, always booked, because once they receive one treatment, patients always wanted to go to that manual osteopath. And this is the beauty of manual osteopathy. So you have a chance to work in a hospital. You can do it. It's a little harder than usual. It's not that easy. Make a connection with hospital staff. Find who is the chair of the department. Communicate with them through email, phone calls, letters. Contact the president. Build a relationship with them, and slowly you can explain to them what benefits you can bring to that hospital, and that may open a job for you, and you can become the only manual osteopath in a certain country in that hospital. It's a big prestige for you, big prestige for manual osteopathy professions. Remember, always think laterally, not straight. Think sideways. There is always a way of doing things if you just sit down and think about it and find a way. That's what I do. I always find a solution for problems. I find a creative way of doing things. When you do things differently, you create a new thing and you expand the profession, and that's so beautiful. Anyway, that's it for today. I see one of the neighbors cutting the grass, and the grass cutting noises started to come here. I'm in Naples, where we have the first and only manual osteopathy university in US. And Naples is beautiful. It's the most beautiful town in US. And everything is designed for beauty here. It's a luxury town, but every day they cut grass here, every day, because of the rain and stuff. Grass grows really fast here, so everywhere I go, I have to make sure they're not cutting the grass on that time, or I have to wait until they cut the grass, because the noise is always there. This is one thing I never noticed anywhere else in the world. Every day they come to cut the grass, and the grass here are so thick. But as I said, it's a beautiful town. It's a luxury town. They make tons of money here. Mostly senior citizens here. All are wealthy. And if somebody open a manual osteopathy clinic here, they can make easily $200 to $300 per hour. Massage therapists here charge on average $150 an hour. Easily a manual osteopath can charge $200 to $300 US an hour. It's going to be a very lucrative business for manual osteopath here. Have a nice day. Enjoy the rest of the day, and until next time, bye for now. Namaste.